Good morning, everybody. We're a little earlier than usual. That's in part because this is Law Enforcement and Hospital Worker Appreciation Week. So I'm heading down to Bridgeport to thank the folks on the front lines while I tell everybody else to stay safe and stay at home. Law enforcement and hospital workers, we ask them, we need them every day to go to work, and that's just what they've been doing. So that's where I'll be this afternoon in Bridgeport. Very quickly, the only numbers I have to update at this early hour are the hospitalization numbers, which, as you know, for me is the key metric, and they continue to go down. They're down about 70 hospitalizations since the day before. That's the biggest one-day drop we've had in some time. That's about 40% less than our peak a few weeks ago, and that's a key trend that continues in the right direction. What does not continue in the right direction are the job numbers. You probably saw yesterday the job numbers came out, or to be more exact, the joblessness numbers came out. And it's the stuff we haven't seen since the Great Depression, much worse than what we saw just in 08, 09. You probably saw that we've processed over 500,000 claims here in this state, all really in the last month. You see that that's about $1.3 billion plus in claims that have been deposited into your accounts. Of that, roughly half is traditional unemployment claims. About 25 million or so is for the self-employed or gig workers. I know that took a little longer to get up than we wanted, but that is getting out. I can tell you that 20 other states in the country haven't gotten any of those claims out as yet. So I do salute DOL for catching up there. A lot of that, half of that is related to the $600 true-up that you get from the federal government, which makes the benefit generous from now until July 31st. So I know there's a temptation to think this may go on for a long time. Right now, it's July 31st. So we got to think about the next few months very carefully. The same holds for the PPP loans, the Paycheck Protection loans, whereas about 65% of all of our companies got this loan. Really good. That's over 60,000 small businesses got that loan, and 75% of that loan has got to go to keeping people on payroll. So, and that's a loan that goes for 2 months. So again, if a lot of those loans finally dropped about a month ago, there's about another month to go on those PPP loans and those people on payroll, which is why I still want to thoughtfully try and get people back to work, looking at that window as it comes up in June and July. And just as a brief reminder, and we've said this a number of times before, David Lamont and Gwendolyn Thames, I think, have done a really good job getting us in the top 5 in terms of states that have gotten this second round of PPP loans. There's still $100 billion there. And again, I urge you, if you haven't as yet, you thought maybe as a not-for-profit you weren't eligible, go to DECD, go to their website, and we can see if we can get you in that queue while there's still money available. Somebody's going to get it. Why not Connecticut? The job numbers are also a little understated because unlike 08, 09, where government workers were a significant piece of the job claims, at this point, and I hope for the foreseeable future, there are no layoffs at the state and municipal level. And that's why we're working very closely with the federal delegation to see what we can do to make sure we'll be able to maintain that quality. And that's key to our workforce going forward. But the other thing that breaks my heart, not simply that we have a bridge that takes us to July 31st, and that's a date that's coming up, but also the unemployment claims disproportionately impact women, disproportionately impact people of color, disproportionately impact young people, many of whom it's their first job. That's who's gotten slammed, many of those folks in the service sector. And that's why on May 20th, we're starting a very thoughtful way to start those businesses to get slowly back on their feet and get those people back in the game. With public health and public safety as the number one priority, Josh has told us we may have some honking from some protesters a little bit later in this newscast. I think that is the transit workers who are hard at work, front line every day doing their job. They're asking for more masks. We've given 50,000 masks to date, and we'll be able to do more. These are all private companies, by the way. I'm used to private companies standing on their own 2 feet, but we're here to back them up in any way that we can. In addition, when it comes to PPE for our small businesses, we got that available via CBIA website. Now for houses of worship as well as not-for-profits. And Paul has reminded me that we're now distributing 50,000 thermometers to small business, houses of worship, not-for-profits. That's a way that you can take a temporal scan, see if there's a fever, another early indication of how you're doing, how to keep your flock safe. And finally, and we dwell on this a lot, is testing. And there's nothing more important as we ramp up our testing, not just to make it available, but take it to the communities that are most vulnerable, most at risk, so we're able to make sure they get tested and treated in a way that keeps them safe and keeps their community safe. And with that, I'd really like to introduce to you Tom Moriarty from CVS. I think you've met Larry Merlot before, the CEO. Obviously, CVS and Aetna are one in the joint. We consider CVS like a Connecticut company, and I am so proud that they think of us as a part of the family as well. They've got the first drive-through testing facility in New Haven, one of the first in the country. And I'm going to steal all of Tom's thunder by saying that he's going to be rolling out another 11 sites across the state, including 2 right here in Hartford. And I think we're one of the first 5 in the country that CVS is making this type of an extensive commitment. And Tom, I could not thank you enough.
Well, thank you, Governor, and thank you for the opportunity to be here. And yes, we do have a big announcement that we announced yesterday. But before that, I want to thank you and your team for the partnership and leadership that you provided on this issue. What we've been able to accomplish so far in Connecticut and a number of other states is due to our employees, our colleagues, and some 10,000 of our colleagues are in Connecticut residents, working hard each and every day on behalf of the folks in Connecticut to make sure that they're getting access to the health care that they need and access to testing. And the New Haven location, which we stood up several weeks ago, was made possible thanks to your leadership, but also the incredible support from the National Guard and others there who gave us the support we needed to get that up and running. And since the opening of that first few sites, our focus has been on people's health and expanding access to testing. And so the announcement we made yesterday is significantly expanding our testing capabilities, not just in Connecticut, but across the country, with the goal of having up to 1,000 CVS pharmacy locations conducting testing through our drive-through sites. So the first of these will be in Connecticut. We're opening actually 12 today, and by the end of the month, there will be 25. Testing will take place through windows, not in our store. We'll be adding about 1.5 million testing per month to help keep states safe and reopen their economies. You know, another important facet to what we've been focused on is serving the underserved communities and meeting the needs there. And we partnered with a number of organizations, but including the National Medical Association, to help improve access to testing and necessary care for historically underserved communities. But the testing effort is just one aspect of what we've been working on. Another critical part of our response has been in mental health. Since March 1, this is an important statistic, we've seen a 200% increase in virtual mental health visits as compared to the same period last year. And healthcare workers in particular are under extreme stress and anxiety, fighting to save lives, while in many cases isolating themselves after their shifts to keep their family and friends safe. So we are offering expanded services and resources to all frontline workers and healthcare workers across the board, essential workers and senior citizens, whether or not they are covered by our Aetna Health Plan insurance. I want to make sure to mention organizations like AmeriCares, the Crisis Text Line, and Give an Hour, who are the partners who are supporting this effort and doing incredible work to provide mental health services for those on the front lines. I want to make sure that the frontline workers know that these resources are available to them, as is the Aetna's Resources for Living program. We believe our approach across COVID-19 has been comprehensive, supporting healthcare workers, clinicians, and patients as we address this pandemic. And we have also then provided uninterrupted access to prescriptions by waiving the cost for a free home delivery, offering 90-day prescriptions, uninterrupted access, so that those folks can shelter in place safely and not have to venture out unless absolutely needed. So, Governor, again, I want to thank you and your team for all your support and your leadership, and I'll turn it back to you.
Tom, who do they contact to access your amazing telemental health services?
They can go on the CVS.com site as well as the Aetna.com site, and there'll be information there regarding the mental health services that are available.
Yep. Maybe we link that into our 211 service at some point. Tom will stay online if any questions as well, and per usual, we got Paul and Josh here as well.
Boceto Media.
Good morning, Governor, and everybody. Governor, can you please give more details about the future of the homeless population on temporary shelters? Will they remain in hotels through all the phases of the reopening? Because they are a big part of the vulnerable population, because most of them are part of the elder community.
Yeah, no, thank you so much for that question. Absolutely. First of all, thanks to Tom and thanks to our mobile vans, we are going to the homeless shelters. We are going to be testing people there. We are testing people there. That is a priority, testing symptomatic and asymptomatic. Anybody who tests positive for COVID, we are finding them an alternative place where they can be, often in a hotel, so they're quarantined and they're kept safe. And we are providing them meal support as well. And this is not subject to any phase. This is happening now for the foreseeable future.
And Governor, how can you reassure the people of Connecticut that the reopening on May 20th is safe, especially when there are 10 children that are now at jail in Haven Hospital? Speak of this unknown illness that is linked to the coronavirus. Many parents are sending emails and asking if it'll be safe to open on that day. Thank you.
Yeah, the question was, given a new version of the COVID virus and how it impacts kids, how can you be absolutely sure that you can do a partial reopening on May 20th? And I think the answer to that is we laid out with our Reopen Connecticut Committee, with the lead scientists we could, very specific metrics on what we thought it would take to keep us safe, make sure we can contain this virus. And that's why we're taking these small steps now. And as you heard earlier when I spoke, this is the core population is most likely to be impacted, most likely vulnerable citizens, women and people of color, and we want to slowly and cautiously get them back to work.
CT News Junkie.
Thanks, Max. Good morning. Governor, when will the asymptomatic people be allowed to start getting tested?
In the vulnerable populations right now, in the nursing homes, in correctional facilities, homeless, like I just said, those vulnerable populations living in underserved communities, we're going to be testing symptomatic as well as asymptomatic, doing everything we can to protect them and protect those communities.
What about beyond the vulnerable populations? Asymptomatic people should not be going out and getting tested right now?
Paul or Josh, do you have a timeline on that? Asymptomatic beyond the vulnerables?
Right. So our testing strategy, as the governor described, is, first priority, as it has been, is anyone who has any symptoms should be tested. So that's fever, cough, fatigue, difficulty breathing. Any COVID-related symptoms, people are encouraged to go get tested. And as the governor mentioned, our next set of priorities is on the populations that are most at risk: nursing homes, staff and workers, correctional facilities, inmates and workers, first responders, people living in our more adversely impacted urban communities. as well as people who have been identified as having had close contact with somebody who may have tested positive for COVID. So those could be people who are asymptomatic, but if they believe they've been in contact, notified through a contact tracing or otherwise, we definitely encourage them to go get tested. We're not encouraging the worried well, as they're often referred to, who don't have any reason to suspect that they could or would have COVID. We're really looking to prioritize testing capacity for the coming weeks around people who are in those higher risk profiles.
And Governor, what will the second phase of reopening look like? You said that indoor dining could be part of the second phase. What else is going to be part of the second phase?
I said that indoor dining might be considered as part of the second phase. What I want to do, Christine, is let's let May 20th go. Let's see what happens in terms of activity. Let's see what we can learn. I think we've learned, from Georgia that there were not a lot of flare-ups there as they slowly reopened, or not so slowly reopened, and that was 3 weeks ago, and that's relatively good news. We also learned from Georgia that the customers, the consumers, were very slow to go back to the stores that were reopened, so did not have the economic impact we thought it might have, nor did it have the flare-ups we thought it might have. But this is such a fast-changing, let us figure out June 20th, a little bit after May 20th.
And just kind of an awkward question. So when the restaurants are open for outdoor service on May 20th, will the restrooms be open for local transit and truck drivers who may have to use the restroom?
You can take that one.
Yeah, no, there's nothing in the guidelines that prohibit the restrooms from being open for those purposes.
Thank you.
The Connecticut Mirror.
Good morning. Question for Mr. Moriarty. Are these testing sites going to be using the Abbott test?
No, the rollout that we announced yesterday and are pursuing over the next 2 weeks involves what is called the swab and send. So it's a nasal swab that then is sent to one of the major labs and regional labs, and the results will be available in roughly 48 hours or so. So it's not the Abbott test.
And what's CVS's approach to Abbott at this point, given the FDA alert that went out Thursday?
Yeah, so the Abbott point-of-care tests are being used in the large-scale 10 testing sites, and we have been using those since the start. The percentage of positive test results from our data off of these large-scale sites actually has been higher than the state averages, so it has not been raising any red flags for us in terms of what we've been seeing. The FDA did identify late yesterday that they've seen 15 adverse events. That's out of 1.8 million tests that have been done on the Abbott device. So we're obviously going to closely monitor and take instruction from the FDA as to how we proceed and work very directly with our state partners on the next phase addressing these issues.
How is CVS being reimbursed for these testing? People are not being charged if they don't have insurance. So where is the money coming from to underwrite this?
Well, at the swab and send model in our retail locations, that will be covered largely by insurance through Medicare and Medicaid. And as you indicated, that there is an uninsured fund as well to cover those who do not have insurance. And importantly, as you also highlighted, under the CARES Act, which is the federal legislation, there is no co-pays or out-of-pocket costs for individuals for COVID-19 testing. So there will be no out-of-pocket costs for folks who do qualify to be tested.
And a last question. You are a lawyer in a business that is highly regulated, both as far as pricing of things, of what is authorized to use. What has been your feeling watching the the rapid rollout of a lot of stuff, understandably, of doing things very quickly. As the top lawyer for a company that does health insurance and provides health products, what are your thoughts about that?
Well, it's a great question. I mean, obviously, we have a significant national emergency that we're undergoing right now. What we are doing at CVS is, as we are expanding services and expanding scope of care that our pharmacists, our nurse practitioners are now being permitted to do, we are tracking quality and safety metrics to ensure that the status and the quality before the pandemic is equaling what we're delivering going forward. So these changes are needed to meet the massive need right now, and we are making sure that what we're doing as a company meets all the necessary quality and safety standards applicable.
Well, and one last thing, Mr. Curdy, are there any lessons that you're deriving from this that are going to permanently change how CVS does its business? CVS obviously has been looking at doing more stuff on site at its pharmacies, but is there anything from this experience that you think is going to permanently change how CVS does business?
You know, most folks know us and think of us as the corner drugstore. What a lot of people do not appreciate is how large of a healthcare presence we have. We have some 50,000 healthcare professionals, colleagues, employees, doctors, nurses, nurse practitioners, pharmacists, pharmacist technicians. So our ability to deliver healthcare locally and meet the need locally and be in the community and help also in the underserved communities, that's a valuable lesson that we are going to continue to work on and bring forward, even coming out of the COVID-19 pandemic.
Thank you.
NBC Connecticut. Channel 3 Eyewitness News.
Good morning, everybody. Governor, last night on Face the State, you said that you can go to that drive-through test in New Haven, get an appointment at any time and go. I encourage people to get tested, symptomatic or non-symptomatic. However, we've had a few people tell us that they've tried to get tested, but they've been denied because they don't have any symptoms. So can you clarify the statement that you made last night? Can anyone get tested at this point?
I think it's symptoms and mild symptoms, but perhaps Mr. Moriarty can lend some insights, or Josh, on that.
Yeah, I can start. Maybe Josh, you can add. Obviously, the focus at the large-scale testing sites initially was on first responders, essential workers, and those with symptoms. As the situations evolve and we start getting into asymptomatic questions and the ability to identify folks who may have been in contact, these testing criteria are going to evolve to meet those needs.
And then I had one follow-up question. Governor, earlier in the press conference, you said that unemployment has disproportionately affected people of color, women, and young people. Is there any specific plans in place to help those specific groups, especially if they run some type of business, so disadvantaged businesses?
Well, one, let's start reopening those companies and those businesses where those people are working. Number two, you're absolutely right. We have got a special fund together at DECD, Economic and Community Development for Women and Minority-Owned Businesses. Our federal delegation, led by Senators Murphy and Blumenthal, made a big point in this last supplemental that was passed, what was it now, a couple of weeks ago, set aside money for women and minority-owned businesses as well. So I think they're making a good effort there.
Thank you so much.
The Day of New London.
Hi, I have a few questions for the governor about reopening. I've had some conversations with a couple bridal shop owners who are very concerned that they've lost, their busy season already, and now with reopening, that fitting rooms can't be open. They only want to have just one person come in at a time by appointment, would disinfect between appointments. So I was just wondering what the rationale is for having all fitting rooms closed, and if there has been kind of any conversations around accommodations for the bridal dress industry.
I think we maybe are making some accommodations about the fitting rooms, or at least in the clothing stores where you can try on clothing. But I think you still want to be very careful here. We want it to be by appointment only. We want to make sure that if you try something on, it does get disinfected before it goes to somebody else. I think we're setting in some protocols that make it more possible for you to do this, but to do it very safely.
And so is that if there are people who kind of want to be able to have these accommodations to, by appointment only, just have one person come in at a time, try something on, is there kind of some recourse they have or someone they could reach out to?
Yeah, do you know about that?
Yeah, so the recourse is we ask every entity that's going to be opening May 20th to self-certify. Now they'll get all the necessary guidelines and also to certify that their entity and their business was safe. We also have the ability for them to provide questions through that site, which they can get further clarity on the very particular questions based upon their overall entity. As you know, the guidelines we put out states retail as a whole, but within retail there's niches within it, including, as you said, bridal. I want to thank the great work of David Lamont, his team at DECD, Department of Labor, and our OSHA group who've worked tirelessly and continuously to work as we're working to May 20th to make sure that we have guidelines, but also recourses based upon particular situations.
If you want, send the email to Max so we can answer specifically your question about fittings.
And then in terms of, I know when the advisory group first made its recommendations, I know that university research programs and outdoor recreation were also mentioned. I was just wondering if there will be any guideline for those two sectors coming out.
Well, university research, we did say was, I think in this stage, the May 20 stage, mainly remote, easy to get going. And as we think further down the road this summer, it'd be probably graduate students who would be the ones most likely to be in the residence hall. So you can see how we're trying to phase that in over time. What was the other category?
Outdoor recreation. I just don't know if there'll be any guidelines up for that, along with restaurants and retail and the others.
Well, for the outdoor recreation, yeah, we had a good conversation with Cordona and Beth By. Our plans for certainly summer camps opening up, I think it was June 21st. Why summer camps? Because you can be outside, you can be in a smaller group. How that segues in July into some outdoor sports where social distancing can be monitored. I think you can count on that in this future.
And then one last question, who will enforce the guidelines, and will there be any penalties for violations?
Well, to start off, you will. I mean, we're finding in this first stage with safe stores and safe workplaces, fellow employees said, put on your mask. Proprietors said to customers, you're responsible for putting on a mask. We found in many cases that if a customer did not feel comfortable enforcing it themselves, they called our hotline and we got a message out pretty quickly. And we're working on further enforcement as we think it may be needed going down, and that'll be mainly at the municipal level, and we'll get back to you with that very soon.
The Waterbury Republican American.
Thank you. Do we have a total on the amount of money that has been spent housing homeless individuals in hotels and motels?
We can be able to give you the running total as of right now. We'll be able to send that to you after the press conference.
Josh, you talked a minute ago about the worried well. We're also talking about asymptomatic people. So can you, can't somebody be asymptomatic and worried about having this virus and want to be tested? I'm not quite sure what you meant by the worried well.
Yeah, no, absolutely. And that's one of the reasons that we're expanding our testing now as we bring more capacity online to people who are asymptomatic. The key is that we want to prioritize that asymptomatic testing for the people who are most likely to be at risk. So that's people living or working in nursing homes, working in our correctional facilities, other congregate settings where the virus can and has shown throughout this crisis worldwide that it can spread very rapidly, and other people who are in high-risk situations or have had close exposure to someone who's tested positive. So it's really just a question of prioritization. But if you think you are in a position where you have been put at risk due to COVID, then we would, even if you don't have symptoms, then we would encourage you to go get tested.
Governor, got a reader, I don't know whether it's a question or a complaint, really, but this individual was sort of upset that the fact that, there are unemployed people collecting, as much as $1,200 a week, and someone who's making $40,000 a year is making about $780 a week, and they're not getting anything extra other than a $1,200 stimulus check from the federal government. What do you say to folks who sort of, I guess, feel a little bit of resentment as they are working and others are collecting?
Look, I understand the concern. Let's put it this way. It was for 90 days in the midst of the worst pandemic this country has ever seen. So it's not like a long-term handout. It's a hand up for the next 90 days, and it goes till July 31st, at which point all those unemployment benefits probably get back to a more normalized status.
And some stats came out today. Retail sales, I guess, are down 16.4% nationally. What do you think the situation here is in Connecticut?
I think we've been hit hard. And I think it's going to be a slow way back, but I think we're starting on May 20th. And I think it's really important that store owners take these protocols very seriously, because customers will be watching, and they're going to want to go in the stores where they think they're serious about the protocols.
And do you have any percentages of the number of unemployed or unemployed applications from young people, women, and people of color?
I don't have those percentages.
Yeah, we'll get back to you afterwards, but I know that on the DOL website, they have been keeping a track of those particular segments. So we'll be able to send you the link as well as answer any particular questions that you have afterwards, Paul.
Okay, thank you very much.
The Hartford Current.
Governor, the deaths, as you know, the deaths increased on Thursday to 94, and we're not quite yet at the 42,000 tests that you have mentioned. If the deaths are not declining, will you push back the May 20th reopening date?
No, as you know, Chris, deaths reflect, I'm afraid, things that were happening some weeks ago. So compared to hospitalizations and testings and PPE, it was not one of our 7 metrics, but it breaks your heart every day seeing those numbers.
Okay, also with Memorial Day approaching, and it's going to be 80 degrees today, there's definitely going to be larger crowds at the beaches and the parks. Deep has already closed down some parks and on various days, but how will you enforce social distancing at the beaches?
Well, Deep hasn't closed down any of these parks that I know of. I think what they've done is said we're limiting the amount of parking at these places. So sometime in the middle of the day or early afternoon, if they're loved to death, we have closed down the parks at that point. I know that Katie's also looking for a way for out-of-staters, if they really want to come, don't come, stay at home. Your beaches in Rhode Island are pretty nice, by the way. But we can be charged and they would get an appointment only, another way that we can keep down the load on those beaches. And no, I don't think we're going to have state troopers walking around the beaches, but I do think that local municipalities are going to be monitoring that very carefully. If they're lifeguards, I hope they're paying attention to it. And if you're there and you see some people acting in a way that does not promote the public health, I hope you speak to them.
And Chris, I just add that Chris, I just mentioned that we're also planning. Commissioner Dykes is going to be joining one of our press conferences next week as we head into Memorial Day weekend to provide a comprehensive update on a lot of the plans that we have in place to ensure people can enjoy the summer as we head into it, but do so safely.
One last thing also, Governor, what can you tell us exactly what is the role of the Boston Consulting Group? Are they working, or will they be working side by side with DPH, or will DPH be telling them what to do? What exactly will they be doing?
Well, I'll start on this, and then maybe Josh wants to fill in. But the Boston Consulting Group has really had a focus on COVID and COVID responses. And they're being used by most of our neighboring states, so it's one more way that we can better coordinate our efforts there. And Paul has reminded me they're also being used by the 7-state consortium. So when it comes to track and trace, when it comes to testing strategies, when it comes to openings and closings, ways that we can coordinate on a regional basis, they'll be there working right alongside our different departments and commissioners, lending us the expertise they've got as we ramp up implementation. As you know, the Reopen Connecticut team is winding down next week. They put in place the very best health metrics we had. We're testing now against those metrics to see how we're doing. Now we have to implement for the next 3 months, and BCG is going to help us get started there.
And did you have anything to add on that, Josh?
No, I think it's just worth pointing out. I mean, the interventions that we're putting in place from a public health perspective, a wide variety of things that have never been done before in state government here in Connecticut or really anywhere else. And then linking that to, our efforts to essentially re-engineer our entire economy as we move into this reopening phase, and link the two is I think as most people can appreciate, is an immensely complex piece of work. So having some people who can work side by side with us 18 hours a day, 7 days a week, bringing in all the inputs that we're getting from all the stakeholders is incredibly important to our effort to be able to move at the speed that this crisis demands, and do so in as smart a way as possible.
Okay.
NBC Connecticut.
This is Telemundo, Connecticut. Solange Sosa, Governor.
Yes, I'm here.
Yes. So yesterday you mentioned on your press that you heard a caravan of, you heard horns outside of the Capitol. I'm sure you know by now what that was all about. And I'm wondering if you have a comment for that.
I believe it was not about reopening too fast or too slow. I'm told it was about immigration. Am I right on that, Paul?
Correct, yes.
And look, my comment on that, assuming that's correct, my comment on this is as follows. We are all God's children here in the state of Connecticut, and the COVID virus does not differentiate between immigrants and non-immigrants, documented, undocumented, white, Hispanic, and black. It goes after all of us the same way, and that's why we're taking care of everybody, with a special emphasis upon the vulnerable population, making sure they get the testing, they get the treatment, they have the health care, and they have the separate living plus food as they need it going forward.
Governor, they were asking specifically during this caravan, during this march, for a fund protecting those, especially immigrant undocumented workers that are not covered under government or federal aid. They don't qualify for unemployment benefits. They don't qualify for food stamps. And they're asking the state to follow suit on other states that are creating funds for this group of people. Is Connecticut planning on doing anything to help them in that sense?
I don't know if Connecticut is, but I understand that 4CT, our amazing philanthropic effort that has raised well over $15 million, is certainly looking at the undocumented ways that they can be supported during this pandemic.
Is there anything that you can tell them? They said that this is only the second of many marches, and that they will continue to march into something it's done and addressed towards their community.
I think I've tried to describe a lot is being done broadly for all of our vulnerable populations, including the undocumented, in terms of what we provide for supports, what we provide in terms of no evictions, what we provide in terms of no utilities can be shut off, what we do in terms of testing. I think we're doing a lot, but as I said before, 4CT is trying to find a package that they can work on that may provide some additional support.
Hearst, Connecticut
Thank you.
Media.
Just one more.
Hearst, Connecticut Media.
Is she doing a follow? No? Okay. Governor, on your advisory group, you told them to, they disband on May 20th, but have you told them to stand by the phone and depending on what's going on, there seems to be a lot of expertise there that you might want later on.
Yeah, on a very informal basis, absolutely, Ken. Starting with Dr. Koh. He's paying special attention to this as somebody who's spent his whole life on infectious diseases. This is his moment. He's put in place a team. So on a very informal basis, yeah, I will be reaching out to them whenever I need some input.
Thanks. And earlier in the week, we were talking about training local health departments in contact tracing. Maybe I should ask Josh how that went. Is that finished? When are they going to start talking to people, or have they started talking to people and recruiting the 400 to 500 other people?
Yep. So the system's live. The first 3 local health departments were onboarded and trained earlier this week, and we've got actual, live data, live cases now working through that process. So they're making great progress. Over 300 people onboarded with credentials to participate in that process, and additional trainings and additional local health departments being onboarded every day for the next week.
And they're still doing texting, phoning, and possible face-to-face, or how is that playing out?
Yeah, it's really reliant on texting and email to try to automate as much as possible, and then phone contact where follow-ups are required or a more personal touch is required. Any local contact would be done through local health departments, and we expect that to be relatively rare.
And Governor, could I ask whether you've got summer school guidelines set up yet, or is that still too early?
I think certainly our education team has been working on that, Ken. They are planning summer school. They're hoping that gets going in July. Probably smaller classes, a little more outside oriented if we can. Details to follow.
Thank you.
Connecticut Public Media.
The CDC has released guidelines for reopening schools, the workplaces, and camps, et cetera. Have you had a chance to review them, Governor, and do they provide the state with the guidance it needs to move forward?
Was that about the CDC guidelines? Is that what you were asking?
Yes.
I got to say, all I've seen is reports on them, and they're pretty vague and pretty generic. I think we're sort of on our own in terms of guidelines that really give businesses, not-for-profits, camps, schools, the type of protocols they need to be safe. And I'm doing this in coordination with the best practices from other states.
News 12 Connecticut.
Hi, good morning, Governor. I have a motion in front of me here for a restraining order that's been filed against the director of Orange's health department on behalf of an Our Lady of Sorrow church. The church says the town shut down religious gatherings, which would seem to go against the wording of the March 10th executive order from your office. Do you have any opinions on that? Is it a violation of the right to worship, or do you think towns need to have the power to prevent large gatherings, regardless of their purpose?
What I do know is we have said there is a carve-out for houses of worship. They can have, up to 50 people there with the appropriate social distancing. And you know me, I think people over the age of 65 should stay home and worship in a different way. I can't tell you about the specific case in Orange, but I can look into it and get back to you.
Excellent. Thank you, Governor.
News 8.
Good morning. This is Sabina from News 8. So I had a question for those workers who we're hearing from who say they're going to be having to refuse employment next week because of childcare, schooling, safety issues. We know that the DOL is going to determine their benefits whether they'll continue with unemployment benefits on a case-by-case basis. But considering that the DOL system is already dealing with such a heavy load, I know that you're working with the DOL, Governor, to come up with a broader policy to address those workers' concerns. So will that be announced by May 20th? Will you have anything in place by then?
In terms of the child care, you mean?
In terms of the workers who say, we don't want to go back to work because we have to do homeschooling, we have to take care of our kids, or if they're concerned about their safety. Yeah.
Absolutely. So I think you're going to find these stores, these salons, these barber shops, these restaurants are opening up slowly. And what we've said is over 65, pre-existing conditions, do not go to work. Take out that category of people. And then if you don't feel comfortable going to work, you can't go to work now, work out with your employer. So maybe in 2 or 3 weeks, if you've worked out the child care, let's assume the restaurant starts building up its load, you can go back at a later time. And in the meantime, you can collect your unemployment benefits.
Okay, so that's the policy, that if somebody is refusing work because of some of those issues, they can continue to collect unemployment, and that process will be simplified for them.
Yeah, I mean, don't just refuse. It's probably good to talk to your, talk to your company and make sure that they understand. But my understanding is, in most of these cases, they're working that out because they have more seats than they need employees at this point until they get back to stock.
Okay, and I have a question for Josh. A couple of weeks ago, we had talked about the letters of enforcement that had gone out to several nursing homes. And I know the nursing homes had a period of time, about 10 days, I think, to respond. It seems like we're at the end of that 10 days now. So are you going to release the results or the contents of those letters, as well as the results of the inspections that you were doing with the National Guard?
Yes, I think the first batch actually was completed yesterday, and I believe the DPH team is in process of releasing those publicly today.
And where do we stand on testing with nursing homes?
Testing in our nursing homes is proceeding at an accelerating pace. We are now covering a wide number of nursing homes. Every day, our National Guard is delivering supplies out to nursing homes to make available for both their patients and their staff to be tested. We're working through some issues with the unions that represent staff in some cases to ensure that their particular areas of interest are addressed so that their staff can be tested, but we're making all the supplies available as quickly as possible.
And Governor, now that the testing is getting underway at the nursing homes, over the summer, will you consider at those facilities that could accomplish this, could there be outdoor visits for families to finally see their loved ones?
I hope so. I'm going to wait for the final report from the reopening committee, but that does seem like something we might be able to do now that testing's coming into place, and I love the way you focus on the outside.
The Associated
Governor,
Press.
One final question from News 8. What are your personal plans for May 20th?
My personal plans for May 20th is probably have a nice meal on my back porch with Annie if it's a warm day, and keep an eye on the restaurants and make up my mind a little bit later.
The Associated Press. The Associated Press.
Thank you. Good morning, everyone. Governor, last night some pretty depressing numbers, honestly, came out regarding the nursing homes and nursing home deaths. And the representatives of the nursing home and assisted living facilities said last night they're asking that the use of the COVID-19 alternative recovery centers be expanded. They said right now they're only being used to address hospital surge patients, and I thought that they were supposed to allow people to be transferred from one nursing home to another or assisted living if there's an issue. But they said that they want them to be available to accept those type of transfers. So what exactly is happening, and what's your reaction to that?
You want to start with that, Josh?
Yeah, there is flexibility in the system in cases where, a nursing home that has both positive and negative patient residents is unable to properly cohort in line with the best practices for infection control. Our DPH team is able to help in and provide additional supports. There is still significant additional capacity in those COVID recovery sites that we've stood up. We have I believe right now 267 people in those sites, but there's significantly more capacity than that, and people are being discharged from them every day too. We've already had 43 residents discharged from the COVID recovery site. So that model is working very well and does provide a good backstop if any existing nursing home is unable to properly cohort.
And I understand that the state began gathering data regarding the COVID-19 homes, I think, on last Friday. Do you have any of that information, like how that's going in terms of testing? The recovery statistics, I apologize.
For recovery statistics, yeah, we had hoped to have that together by yesterday. We do have it for the COVID Recovery Center specifically. I just mentioned we've had 43 people already discharged from those sites, but for the other 200 plus nursing homes, we haven't been able to pull all that data together yet, but we hope to soon.
Thank you.
Fox 61.
Good morning, Governor. This is Tony Terzi. Good to be with you guys this morning. Just wanted to check in with you back to the Boston Consulting Group, the $2 million fee. We've received emails from viewers who are upset by that, saying, in these financial times, should we be spending this money? Now, I understand you said that the federal government will be reimbursing us, but essentially it's the taxpayers who are paying for it. Isn't that correct?
Yeah, Tony. Look, the feds have dished out about several $1 trillion. We're looking at a $1 billion deficit. And my priority right now is to make sure that we get through this COVID pandemic, maximum priority on public health and public safety, and then get people back to work as prudently and quickly as I can. And I want to get the very best minds I can, not just for this state, but as we work on a regional basis to make sure we get this done right. And we've talked to the legislative leaders about the consultant, how they're going to pick up where the Reopen Committee is left off. And I think this is a very prudent investment that, as you point out, is fully reimbursed by the federal government to make sure we get this right with the very best people guiding us.
And it's not something that you and your administration could handle on your own without incurring a $2 million cost?
You know, to tell you the truth, I don't think we could. I mean, I'm still getting to know state government. They're amazing people here with a great deal of expertise. But look, there weren't a lot of Dr. Coes and all the people we brought in on the scientific side to help advise us when it came to a brand new pandemic like COVID. And when it comes to the implementation of a track and trace policy, I'd like to attract the very best people to help advise us on how we're doing this and learn from the best practices of other states. We're all sort of feeling our way a little bit here, but let's get the most experienced people we can to help advise us.
Wanted to ask Josh a question with regard to the dental hygienists. You know, they've been very upset about possibly having to go back to work next Wednesday. Josh, has the small working group worked anything out between dentists and hygienists that will determine something different?
Yeah, they've got a draft set of guidance that they're coming together on that I understand could be agreed as soon as today. That provides, a good set of guidelines that both the hygienists and the dentists are in agreement on. But we'll report out on that as soon as we have any further details.
And I'll also add that we are also working with the Connecticut Dental Association to help support on their various PPE needs for dentistry. We have connected them with our procurement teams to be able to actually vet reliable vendors as the dental industry is looking to get back to capacity.
So those elective procedures will continue as planned for next Wednesday?
That's going to be the decisions of independent practices. As Josh has said, we convened the group of dental hygienists, the dentists, OSHA team, to really come through with more thorough guidelines as we look towards May 20th.
Final question here, Governor. There were 9 Democratic state senators yesterday who sent the letter encouraging you to slow your roll with regard to reopening date and saying May 20th too soon. What's your reaction to that?
Well, everybody knew what our metrics were going back a few weeks ago when we announced them very clearly. I think you've seen we're following those metrics closely. We've met or exceeded almost all of them. Give us a few more days, and I think people have some confidence that we're doing this in a very appropriate way. We also have an opportunity to look about what's going on in other states. I told you about Georgia, which is the canary in the coal mine. But that doesn't mean we don't take our eye off the ball. Max, I think you have a slide of what's, for example, going on in Wisconsin. And that's worth noting because there, I don't want to give our state Supreme Court any ideas, but in Wisconsin, they ended the governor's right to have any social distancing rules, and all of a sudden the bars turned on like a light switch and people came in force. And that's the type of thing we want to try and prevent as we go forward, coming into a really nice weekend like this. And Max, do you have the other slide? And we're being careful about what we open and what we don't open. What we do want to try and open, here's one from the Hartford Courant the other day, haircut. You see some fairly shaggy people going by. And this amused me. It's sort of a back alley type of operation. We'll be able to take that back into the barber shop come May 20th on a very strictly protocol basis. So no bars, yes barber shops. I hope we're getting the balance right. And I hope you stay safe this weekend. Thank you, everybody.